Welcome back. We're talking about the challenges facing Native Canadians and Americans. We've addressed the suicide epidemic in these two countries, but there is more work to be done, as we heard. Still with me, Dawn Lavell-Harvard is president of the Native Women's Association of Canada. Denise Desiderio is with the National Congress of American Indians. Cindy Blackstock is with the First Nations Child and Family Caring Society of Canada. And Teddy McCullough is from the Center for Native American Youth. Welcome again to all of you. Teddy, you know, when we look at these the hopelessness that exists in certain places. I mean, as Cindy told us, there is discrimination. There's widespread discrimination, some of it very blatant. But what other kinds of systemic barriers do young people face in these places?
There's a few things. I'd like to point out are born with and are living with the same rates and the same effect have. And so there's a whole slew of different things that are that we're facing, whether it's the education, the lack of education, the lack of a quality education. We talked about healthcare, generally speaking, oral health. Oral health is a big thing that we're focusing on because you imagine you're going to school, you have a tooth that's been pulled out. Most tribal communities don't have dentists, and they lack the trust to go to a dentist because, you know, some dentist might just pull the tooth out because they don't want to drill and fill and all that kind of stuff. Kids have to travel 3+ hours to get to a dentist or any health provider. Our communities are in some communities are in very remote areas where you don't have access to the things that any other American might have access to. So yeah, I think there's a whole slew of things. The housing, poor access to housing. You have houses that are without running water, without plumbing, without heat, without doors. And the federal government is responsible for providing these things.
Dawn, when we look at healthcare resources that are available to these communities, I want to look specifically at one particular type of healthcare, and that is mental health care. I mean, do people have access to things like therapists, psychologists, psychiatrists? Because we're talking about suicide rates going up here.
Unfortunately, in many of our First Nation communities, they don't have access to even the most basic health care. I mean, we had an incident of a 5-year-old boy who died of strep throat. And I mean, how does that happen in 2015 that a child dies of the most common illness that every child gets? But it's because we don't have even the most basic health care in many communities. And unfortunately, that translates into absolutely, we don't have access to the kind of mental health supports that are needed. I've seen in the urban centers how if there's a suicide or if there's a shooting or a tragedy in one of the local schools in the urban center, they have entire crisis teams. You know, the staff, everybody pulls together. They have teams of people going into the schools. And yet in our most vulnerable communities where they have suicide after suicide, you know, it's the teachers who are there 24 hours being asked to be there for the children because they don't have even one mental health worker in that community, and they're left to struggle and cope and try to get through this on their own. So unfortunately, there is essentially post-traumatic stress, not only for the children in the community, but the teachers in the schools who are struggling to cope, the nurses, and it really does start to ripple, and it starts to break down the coping mechanisms of the entire community when you don't have any access to the kind of mental health supports that the rest of Canada really takes for granted.
And if I could add on to that, the only time that it seems that we get the resources we need are when we're in crisis. So you see these response teams that are coming out to the communities now when there's a spate of suicides, which is very appreciated, but we don't get the resources before. So we don't see the kind of healthcare access prior. There's no access to the preventative, the behavioral health that could actually stop the suicides. Right. The only time that we get our resources is after an emergency has occurred, an emergency situation. So we have to be at crisis level to get the basic services and healthcare that folks take for granted in other communities every day.
Right, and what you want is continuous health
That's
care and
correct.
access to health care. Cindy, the regional chief in Ontario, Isidore Day, and she said the cycle of poverty, poor health, suicides, and violence will continue for another generation if the determinants of health are not addressed right now. And, you know, here's something that a lot of our viewers around the world may find surprising when we look at Canada. I mean, this is a wealthy country, a developed country.
Yes.
It's got a globally admired national health care system. How is this happening?
It's been going on for decades, and I think it's become so normalized in Canadian society. In fact, that's one of the most horrifying things, is that this racial discrimination against children has been going on for decades, and these kids have been receiving less. But caring Canadians who don't know any better are actually judging these children often as if they get more benefits than other Canadians. And the kids internalize that. So one of the things that the Truth and Reconciliation Commission that just wrapped up its study on residential schools really said there needs to be a huge effort put into educating non-Aboriginal Canadians about the situation regarding First Nations, Métis, and Inuit peoples so that we can correct these injustices and bring them into alignment with what the values that Canada says it has for itself and espouses to the world, because right now there's a huge disconnect.
Denise, you know, some of the problems we heard about in Canada was the fact that, I mean, there are basic things that people do not have access to. Housing, clean water. Is that the situation here as well?
It definitely is. We have the largest disparities in every area. And Teddy was talking earlier, that's what youth internalize when they see that your government is treating you as basically a second level citizen. We start to internalize problems, and what's happened is, you know, a lot of people say funding's the answer, and you could put all the funding that you want in healthcare today, but if you don't address the healthcare or the housing needs, the education needs, and provide economic development, then you're throwing money at one area. We silo things here in the United States. And what we at NCI have been asking the federal government to do is take a holistic approach to the needs in Native communities. And, you know, you can't bring a teacher to a school and retain that teacher if you don't have housing. You can't have law enforcement on reservations if you have no place to house them. So these public safety, healthcare, education needs, housing, they're all intertwined. And we have to find a solution that tackles all of those before we can really succeed in any one area.
Right, and Teddy, I'm sure when you find these kind of conditions among these communities, there's also, you know, you always see high rates of alcohol and drug abuse, domestic abuse, sexual assault, violence. All that contributes to this extremely, extremely difficult situation there.
Yeah, alcohol abuse, drug abuse, I've seen it in my family. I'm sure if you ask anyone in this country, they have someone in their family that they know who is using or abusing alcohol. And unlike what is commonly said, Native people aren't susceptible. We're not genetically susceptible to alcoholism.
Right.
It's just the environments that we live in put us in a place where these alcoholism rates, these drug abuse rates are inflated, and it's among youth as well. We travel the nation and we meet with young people, and they're talking about people as young as 11 or 12 using meth, using heroin, and that's also a major issue in our communities.
Dawn, in that meeting that Prime Minister Trudeau is having with Canadian Native leaders, the government is pledging $8.4 billion over the next 10 years to Indigenous programs specifically. Is that enough?
Actually, even though this seems like a significant amount of money, and it unquestionably is much more than we saw under the previous Harper government, the challenge is that it simply isn't enough to meet the needs of communities that have suffered under decades of neglect. And so, you know, trying to play catch up now, unfortunately, requires much greater upstream investments here to address a backlog of neglect in communities that have been under-resourced, underfunded by the federal government for decades, if not generations now. And it's going to take more than one federal budget. Absolutely. It's going to take more than even one term of government for the Liberal government. It's going to take successive terms of significant investment to really start closing the gap so that the circumstances, that the living conditions of First Nations, Métis, and Inuit people in Canada are comparable to the rest of the citizens in this country who have a very good standard of living, a very good quality of life, and our people are suffering. And most often, and we were talking earlier, is that this happens because we have remote communities that are cut off from the rest of Canada. They don't have roads. The only way in and out of the communities is with airplanes, and often, if a flight is $3,000, nobody is going in or out of the community. Right. And so the rest of the country simply doesn't know how bad things have got because they don't have to look at it, because they haven't seen it. It has been hidden for generations.
And that's where we have to leave it. Thanks to all of you for joining us.